Let's talk about Sciatica Sally. Sciatica Sally, and that's not her real name, but it rhymed with sciatica, so I added it on there. Sciatica Sally is a sort of patient that when you come from a purely mechanical model of pain, like most physios, dare I say most chiros, they are depressing as hell to work with. They respond to nothing. Nothing works. They can't pin where their pain is. They don't have any specific movement that hurts. Their alignment usually, I'll put it this way, if they're presenting to me as very depressed, very sensitized to every pain, the pain is everywhere and nowhere. They can't pin a movement that hurts. And when I actually look at the structure and look at how they're moving, there's nothing really off in terms of their alignment. Their feet point, their pelvis is relatively centered. They can access all 8 motions. There's nothing, none of the motions make anything worse than any of the other. Then that's when I know I'm dealing with a sensitized system versus a mechanical issue that may respond to some movement training, if that makes sense. That to me is a person that has a sensitized system that needs a different approach. They will have many limiting beliefs about their pain. They'll have an amazing pain story about, and it's their identity. You'll hear it in their language. I have this. I have had this for many years. I have seen everybody. Nothing works. Now that's true. They're not lying. Nothing does work. They've tried many things and nobody knows what to do with them. They're on high amounts of painkillers. They're not working. They're looking at surgery, but I get the sense sometimes that even the surgeons are putting off touching them because they're not convinced that the minor bulge that's obvious on their MRI could be equating to all these symptoms. This is a different patient type, and these are really challenging patient types. What do I do with these people? It's a good question. I usually end up with these people because they've tried all the other stuff and it's not working. And I guess I'm a little bit, I never know my way in. I have to be super present to the story. I'll be noticing the beliefs, noticing the language, and trying to determine what about this situation is working for this person. Because they may say they want true freedom, they may want to get better, but nothing in their action is matching that. So this is a client that needs high level care. And I will use phrases like, look, I don't know why you're in pain. I'll go through the pain science and talk about pain is an experience that is deeply affected by how you think about it, how you feel about it, implicit memory. And I will then say, from looking at you move, looking at your structure, it all looks pretty good. So I suggest we start looking at these mental and emotional aspects of pain and see if we have any win in that space. Are you open to that? And some are. So we start there. We literally start with their story, their narrative about the pain. Having them notice that they think of themselves as a painful person. They've forgotten often who they were before the pain. So we may start a cognitive inquiry of that. I may help them think about who they would look like without their pain, see if they can even remember a version of themselves that didn't have the pain. Or we may start somatically, just simply starting to unpack how they feel and to notice their feelings, to notice where they feel their feelings in their body, and to what they do with their feelings. What is their connection with their self and their body? It's different for everyone. I always say this in every video. There's no recipe, there's no rule. But I won't start necessarily with movement because I can't really see much in the movement system that I can drastically improve. But I can very clearly see in the emotional system and in the mental system, there's a lot going on. And I find in these sessions, it's a privilege actually, if we can shift one aspect of their experience. The session normally becomes guided by forces outside of myself. I feel sometimes we end up in places that I never would have foreseen we end up, but we seem to land in a space where something is shared, something is revealed, and there's emotional release of some kind. And then there's a clear demonstration of how this person is being with themselves. Are they being compassionate? Are they being judgmental? Do they have love for their body? Do they have love for themselves? Do they feel trapped in a social environment that is just feels like a no-win situation? There's reasonings, there's ideas, there's always reasons people are in these situations. And we slowly try and work our way out of that. Why am I sharing this? It's because I guess I'm in a few pain forums, and I see these people in pain forums with other people talking about their pain, hyperfixated on the pain, not even from a space of curiosity or trying to do anything about it, more from a space of trying to feel validated and understood in the pain. And I get that. But I just think it's a reflection, and I think as practitioners, we can't strengthen someone out of that. We can't move them out of that. I guess we need to tackle things head on. What are their beliefs? What are their emotions? Do they want to start to entertain the idea they can find improvement? Do they want to start to feel better? And start there. Start with looking at what limits they have and expanding them. Start looking at their emotional addictions and train them upwards. That's it. And those two things together can have someone moving freer, feeling a bit more relief, and feeling a bit more confidence in themselves and their ability to be out of this situation. I talk about these skills in my practitioner course, but one of the simplest things I feel is safe for anyone to try with their body is to simply put their hand on where the pain is hurting. Light touch, eyes closed, breathe into the tissues that are causing the most distress and simply be with that sensation. Just really sit with the sensation and then start talking to the tissues. Ask them, what the hell is going on? If it's the whole of the body, wrap yourself, the whole of the body. Body, what the hell is going on? What do you want me to know? What am I not getting? What can't I see? What do you need? And wait. Wait for your answers. See what comes. Going inwards, listening to the sensations, attempting to let them guide us back to what's needed means we don't always have to understand how we've got into a situation, but we can be clear we want to get out of it. And we can get out of it by fully being in it and accepting we are where we are. And to move out of it, it's a day-by-day process. And for lots of people like this, it could be breath work. It could just be somatic connection. It could be dance. It could be music. It could be intentionally just understanding that our emotions are addictive and that maybe you spent a lot of years getting into this space that your nervous system's so chronically adapted to it, you don't know how to get out anymore. And that releasing emotions is part of it, but then intentionally upregulating the system is part of it. We know on the scale of pain and pleasure, pleasure's at one end, pain's at the other. So if the scales are being tipped in this direction, then it's a conscious effort to seek out more of this, more pleasure. Pleasure in food, pleasure in senses, smell, eyes, touch, whatever. There's so many ways. But I don't see that we're offering many of these ways to people in many of these really stubborn chronic pain states. If you've got any ideas of how you have either been as a practitioner with such clients, or if you are a patient like this, what you feel you need from your practitioner, then please drop your comments below. I'm all ears. And just know that my method is holistic. It is just as interested in how you think and how you feel as how you move. Because really, you've got to have all three firing to feel zesty, vital, and alive in your body, which is what I want for everyone. That's to me what a bulletproof body, bulletproof back is. It's energy, it's fluidity, it's resilience. It's all of those key things. And that's my desire for many. And if I can help 2 or 3 of you get there, then I'm all in. I hope this video has helped.